the woman who will become our nation's next Surgeon General, Dr. Regina Benjamin. And the list of qualifications that make Dr. Benjamin an outstanding candidate to be America's leading spokesperson on issues of public health are long indeed. She was in the second class at Morehouse School of Medicine and went on to earn an MD from the University of Alabama at Birmingham and an MBA from Tulane. She served as Associate Dean for Rural Health at the University of South Alabama College of Medicine, and in 1995 she became the first physician under 40 and the first African-American woman to be named to the American Medical Association's Board of Trustees. In 2002, she became president of Alabama's State Medical Association, and she's received numerous awards and recognitions, including the MacArthur Genius Award. It's very impressive. But of all these achievements and experience, none has been more pertinent to today's challenges or closer to Regina's heart than the rural health clinic that she has built and rebuilt in Bayou La Batterie. Did I say that right? Well, tell me how to say it. Bayou La Batterie. That's in Alabama, people. Bayou La Batterie is a rural town of about 2,500 people. It's a shrimping town where a lot of folks work for themselves, scrape by, and can't usually afford health insurance. And by the way, Dr. Benjamin, while we were talking in the Oval Office, described for me the demographics of this town are actually very interesting because you've got whites, blacks, and Asians in this community. There are a lot of Laotians and Cambodians who have moved there and are part of this shrimping town. So it's a diverse but very poor rural community. And like so many other rural communities, doctors and hospitals are hard to come by. And that's why, even though she could have left the state to make more money as a specialist or as a doctor in a wealthier community, Regina Benjamin returned to Alabama and opened a small clinic in Bayou La Batterie. When people couldn't pay, she didn't charge them. When the clinic wasn't making money, she didn't take a salary for herself. When Hurricane George destroyed the clinic in 1998, she made house calls to all her patients while it was rebuilt. When Hurricane Katrina destroyed it again and left most of her town homeless, she mortgaged her house and maxed out her credit cards to rebuild that clinic a second time. She tended to those who had been wounded in the storm, and when folks needed medicine, she asked the pharmacist to send the bill her way. And when Regina's clinic was about to open for the third time, and a fire burned it to the ground before it could serve the first patient, well, you can guess what Dr. Benjamin did. With help from her community, she is rebuilding it again. One disabled patient brought her an envelope with $20 inside. Another elderly man said simply, "Maybe I can help. I got a hammer." For nearly 2 decades, Dr. Regina Benjamin has seen in a very personal way what is broken about our healthcare system. She's seen an increasing number of patients who've had health insurance their entire lives suddenly lose it because they lost their jobs or because it's simply become too expensive. She's been a relentless promoter of prevention and wellness programs, having treated too many costly and diseases and complications that didn't have to happen. And she's witnessed the shortage of primary care physicians in the rural and underserved areas where she works. But for all that she's seen and all the tremendous obstacles that she has overcome, Regina Benjamin also represents what's best about healthcare in America. Doctors and nurses who give and care and sacrifice for the sake of their patients, those Americans who would do anything to heal a fellow citizen. Through floods and fires and severe want, Regina Benjamin has refused to give up. Her patients have refused to give up. And when we were talking in the Oval Office, she said, "The one thing I want to do is make sure that this Surgeon General's office gives voice to patients, that patients have a seat at the table. Somebody's advocating for them and speaking for them." And now we in Washington and across America have to refuse to give up on the goal of health care that is affordable and accessible for every last one of us. We don't have to deal with hurricanes, we don't have to deal with floods, and we don't have to deal with fires. All we have to do is pass a bill to make sure that the American people have a decent shot at getting the kind of choice and high-quality health care that's affordable. And I know that Dr. Benjamin is going to help us get there as the next Surgeon General, and I'm truly honored to nominate her for that post, and Secretary Sebelius is equally excited, even though she's just standing here. With that, let me introduce the next Surgeon General of the United States, Dr. Regina Benjamin.